Okay, say a patient comes into your emergency room or your urgent care or even your general practice, family practice clinic or a pediatrics clinic, and they have a flare up of asthma. They're having trouble breathing, and you think it's because of their asthma. So you hear some wheezing in their lungs. They probably have a history of asthma. It's probably the asthma. So what are you going to do about it? Well, I'll go over the treatment in the acute setting like that for an asthma flare-up. And I think this would be useful for any new providers in emergency medicine or urgent care, or for students, especially if you're getting ready to do a rotation like emergency medicine. Here's what you'd probably want to know. And just as a quick side note, it's kind of interesting that whenever I learned about this stuff in school, about asthma treatment, it was usually always talking about long-term asthma treatment, like when do you add a new medication or a new inhaler or something for their chronic treatment. But it seems like we barely touched on any acute treatment of asthma. Spent a lot more time on chronic. But here's the acute treatment of asthma, basically, in a nutshell. So I'm going to go over basically the tiers from the simplest to the more complex. So you'll basically know like what to use. I won't go over all the doses and things like that because that's getting a little too detailed, but we'll cover the basics at least. All right. So patient comes in with asthma. It's pretty mild. Maybe they don't even look bad at all, but they think they're having an asthma flare-up. What's the first thing you could do? So the first category is breathing treatments. So nebulizer treatments or with an inhaler, but usually a nebulizer type treatment. So what are you going to use? Well, there's albuterol, which is the beta agonist, short-acting beta agonist, and then ipratropium, which is anticholinergic, right? And so usually we'll just use both of those together in the ER setting because there's typically no reason not to just use both of them. So just use both of them together because they may be a little synergistic and kind of help open up the airways. So for some people, that's enough if it's like a really mild asthma issue. And some people are so mild, all they need is a medication refill because they look fine because they already got better on the way there somehow. Maybe because EMS gave them something, or maybe they just got better, whatever. Anyway, so the first category is nebulizer or breathing type treatments. And so you can do that just a basic, dose, or you can have them breathe the albuterol for like a full hour. So that's the higher dose. So like there's enough that it can run through the nebulizer for like an hour. And then you could do the ipratropium with that too, but not as much of the ipratropium. You just do like 1 or 2 doses of that. All right. So what do you do if you think they need more than just breathing treatments? Well, the next thing, and what we often do in concert with the breathing treatments, is steroids. So the steroids are the main thing that's going to fix the asthma exacerbation because they're going to decrease the swelling and inflammation in the airways. But the steroids don't really kick in right away. It takes minutes to hours, usually a few hours before the full impact is felt from the steroid and beyond. So you get them on a steroid, but it's not going to like save them right now. It's just going to save them later today kind of thing. So what steroids can you use? Well, the oral steroids are probably either just as good or nearly as good. So you could just give them prednisone by mouth or some other oral steroid. But a lot of times if they're like breathing really hard, we'll give them like an IV steroid because, it's easier to give and it might kick in slightly faster. So that'd be like methylprednisolone or dexamethasone. So the dexamethasone, I understand, lasts longer. So you could give just 1 dose of that, and sometimes that's good enough. But the methylprednisolone is the opposite. It's really short-acting, so you'd want them to take something by mouth the next day or later the same day, or both. All right, so we talked about nebulizers, steroids, breathing treatment, steroids. What if they need more than that? What if you want to kind of maximize the treatment so you hopefully prevent them from being admitted to the hospital? Well, here's a couple more things you could do. So in some order, the next couple things you'd want to consider would be IV fluids. IV fluids, why? Well, if you're breathing really fast, or probably slower than that, but really fast. I don't know. If you're breathing a lot, you're like you're having more fluid evaporate from your breath, and you probably haven't been drinking much water or anything else because you're too busy trying to breathe. You know how after you work out, you try to drink and you like get short of breath? Well, the asthma flare up is like that, but nonstop. So they might be dehydrated, and so you might want to give them some IV fluids unless there's some contraindication. Another treatment that helps a lot, can help a lot actually, is magnesium through the IV. So like a couple of grams of magnesium. Magnesium relaxes smooth muscle and stuff, so it could help open up the airways. Magnesium is good for a lot of things, but asthma is one where I think it does have probably a significant benefit. So those are pretty much the treatments for acute asthma, and usually that's good enough. But if you want to get fancy, I've heard of people using ketamine. I saw that in some lecture. I've never done it. The other day, one of the docs I was working with wanted to give an IM injection of terbutaline. So that's another beta agonist, but it's going to act, systemically instead of just inhaled. So there's quote unquote fancy stuff like that. In other words, stuff that's not routine, but some people might do it sometimes, because ultimately you're trying to prevent them from getting intubated or just prevent them from having to get admitted to the hospital. But usually if you give them the 4 things that I mentioned first, which were breathing treatments, steroids, magnesium, and IV fluids, usually that's going to be enough unless they have other comorbidities or it's just such a bad exacerbation that they're just not getting over the hump. But typically that would be enough. If you found this video helpful, why don't you go ahead and check out my playlist with some of my other medical review videos. Some of them cover acute topics like this, and some of them are just kind of reviewing other things you might want to know, especially related to emergency medicine, but I'll be covering other stuff in the future. Thanks for being here. See you next time.